Hi, welcome to Webisode 166, I believe. I sometimes lose track of the numbers. Today I thought, since the government's been shut down for 2 days, we would do the first foray into the political spectrum and actually learn about the American Care Act, which is better known as Obamacare. A lot of people hate this, even though Obama was reelected. They like the individual things that the bill provides. They don't like it as a whole, I think, because a lot of confusion. So I decided I don't really know enough about it. I like it as somebody who got sick before and had to worry about health insurance and had insurance companies deny pre-existing conditions and say things were not medically necessary. This is something I welcome because I think the insurance companies need some sort of reining in. So anyway, I did research on it, and some of the highlights that I think are important are that insurance companies can now not drop you if you're sick or if you make a mistake on your application. Before they could, now they can't. You can't be denied coverage for pre-existing conditions. Before you could. You have the right to quickly appeal any decision. There's a large improvement to women's health services. Reforms the healthcare industry that are cutting wasteful spending. New preventive services that are now out of pocket, which will lead to a little probably higher cost in the beginning because everybody's going to go for preventative services. In the long run, that saves money because people are going to go get preventative services, so they're not going to get sick later, which would hopefully save money. You can't be charged more based on health status or gender. Children can now stay on plans till they're 26. I think that's important because, a lot of kids go to college, and then they go to grad school, and they don't have insurance, so I think that's important. What I did learn, and I knew, but a lot of people are thinking that this is like government takeover of healthcare, and it's not. This is this is not a single-payer system, which is universal healthcare, which actually all industrialized countries have except for us. We have at least 43 million people who are uninsured. That's the highest out of anybody. We also have the highest healthcare costs out of any industrialized nation. So these are facts. This is not just... I'm not a Democrat. I'm not a liberal. I get painted as. I am an independent who like to see things better for everybody. That's it. Also, one of the things I really like is there's an 80-20 rule, which before, insurance companies were not required at all to spend any certain amount of money on care. It could all go to profits. If they wanted, they could deny everything and go to profits. Obviously, they didn't do that, but right now that's regulated. There's an 80-20 rule, which means 80% of the revenue they collect needs to go to care. The other 20% can go to profit and administrative costs and things like that. Is this going to be a perfect law? I don't think so. Is it going to have a lot of glitches? I think so. Is it going to take both sides to come together and make it better? Of course. I'm not naive. I get it. There's two sides. Let's get it going. Let's get it together. Do I think the government should be shut down over this? No. A lot of people are claiming that their freedom is being taken away. You don't really understand that. We have so many people in this country that are not covered by insurance. And what's happening now is they're just going to the emergency room, and we're paying for that with higher costs. Why wouldn't you want more people insured? And I think the strength of our country really comes from, how strong our lower classes are, Let's help everybody a little bit so we're all stronger. To me, it's frustrating when I read stuff like our freedom is being taken away, because 43 million, whatever it is, 50 million more people will have access to health insurance because insurance companies that make obscene amounts of money might make a little less so that more people are covered. I don't get it. I don't. And like people are, complaining about this tax, but you're only paying that. Basically, you're not going to pay that if you're poor because you're getting subsidies and you're going to get it anyway, and they're not going to give you that penalty. And you're not going to get it if you're an average. The 80% of Americans that have insurance, so there's 15 to 20% that don't have insurance, and most of those are poor. So you're talking maybe 2% of people who actually make a decent amount of money who aren't getting the exchanges. But the whole reason to get the exchanges is to bring the prices down. So I don't really understand people who are against it. Like a lot of people are comparing it to, they say it's the law, and why should we abide by this? Because it's a bad law, and comparing it to slavery and segregation, and I think that's bad. I think I don't know. I don't think giving people health care is equivalent to any of that. Anyway, this is why our government shut down, because one side doesn't want this law that's already been passed and upheld by the Supreme Court, and the other side thinks, this is the law already. So, anyway, that's, I learned about Obamacare today, the Affordable Care Act. It's living life to the fullest. We have to learn about what's around us, like not just spew out talking points. Learn about it. Like I said, I'm sure there's lots of negatives, and I'm sure somebody will point them out. But, take care.